There are two key findings of our research in terms of the trends in oral diseases over the past 3 decades. The first key finding is that oral conditions are very common. They are the most common conditions around the world. The combined prevalence of these conditions is around 47% globally. And that means they are affecting 3.7 billion people worldwide. Of all of the oral conditions, untreated dental caries is the most common, affecting 2.5 billion people. The second key finding is that there have been considerable inequalities or differences between geographical regions in the world. I mean, looking at the 6 WHO regions, we can see that the European region is going ahead compared to the other regions in terms of controlling the burden of oral conditions, while other regions such as the African and the Eastern Mediterranean regions generally experience worse outcomes compared to the other 4 regions. One of the key indicators in the global burden of disease is prevalence, and that can be measured in 2 ways. One is the number of cases of people with the condition, with the disease we are interested in, and the other one is the proportion of people affected, the frequency of people affected. And these are 2 complementary indicators. So on one side, we have how many people are affected, but numbers alone don't tell us much, because if the population grows, or if the life expectancy or the longevity of a population increases, then there will be more cases available of the disease. And that doesn't give us the full picture. That is why we also tend to use the prevalence, the percentage of people affected. So what we see in figure 2 of our manuscript is that the red lines, the trends in prevalent cases, show an increase in over time, over the past 3 decades. Just to give an example, I mean, if you focus on the panel in the middle of the figure for main oral conditions, there has been an increase in the number of cases of 53%. And the largest increase has been seen in the panel for oral cancer, where there is an increase of 162% in the number of cases. Now, as I said before, this depends a lot on the population growth and increases in longevity. So to account for those demographic changes, we use also the prevalence as a percentage. And that is what we see in the blue lines, in the blue trends. And what you see there in all oral conditions is that trend is flat. So there hasn't really been a change in the prevalence of these oral diseases, except for oral cancer, where we can also see an increase of around 28% in the prevalence. Disability-adjusted life years, or DALYs, are an important metric in the full GBD study, because they allow comparing different conditions and different geographies. Now, for oral conditions in particular, DALYs are quite relevant because they capture both elements. They don't only measure the years of life lost because of premature mortality, so not only conditions that kill, but also conditions that cause disability. And of all the 5 conditions we evaluate in GBD related to the mouth, most of them don't actually kill. They are not lethal. Okay, so we are talking about untreated caries, severe periodontitis, and edentulism. So of these 5 conditions, only orofacial cleft and oral cancer will kill. So by bringing together the DALYs associated to disability and the DALYs associated with premature mortality, we can get a better picture about the burden of oral conditions globally at regional level.